Welcome to This Explainer. If you're a parent or caregiver, you probably know the exact feeling. It's the middle of the night, you touch your little one's forehead, and it feels like a furnace. It's terrifying, right? But today, we're going to replace that middle of the night panic with cold, hard facts. We're going to demystify childhood fevers using a super practical guide from pediatrician Dr. Mahesh Yadav. By the end of this, you're going to know exactly how to handle those late-night temperature spikes like an absolute pro. Okay, let's dive into this. 102 degrees Fahrenheit. That's the number that usually sends us into an absolute panic, right? We're grabbing the car keys, ready to rush to the ER. And hey, I completely validate that panic. It's your kid and your protective instincts are in overdrive. But I want to assure you, right here and right now, that we're going to give you the exact answers you need to navigate this. Because believe it or not, this number isn't necessarily the dangerous enemy you think it is. So here's our quick roadmap for today. First, the truth about fever. Second, immediate steps for care. Third, common mistakes to avoid. Fourth, exactly when to seek help. And finally, the doctor's golden rule. Trust me, by the end of this structured explainer, you're going to transition from pure anxiety to absolute empowerment. Right, let's jump into section 1, the truth about fever. Before we talk about treating a fever, we really need to pause and completely reframe how we look at it. Because a fever, it's actually the body's natural response. It's a way of fighting infection, not a dangerous disease itself. Actually, scratch that idea of it being a disease entirely. Most fevers aren't inherently dangerous at all. Your child's immune system is just doing its magnificent job, literally turning up the thermostat to create a totally hostile environment for whatever virus or bacteria got in. So the fever isn't the villain here, the infection is. What really matters is knowing what to do immediately to manage their comfort, rather than just panicking over the fact that they feel hot. Which brings us to section 2. Immediate steps for care. And this brilliantly illustrates the simple 3-step home care sequence you need to lock into your memory. Number 1, hydrate frequently. Number 2, give a medicine like paracetamol. And number 3, sponge with lukewarm water. Let's break that down a bit. Medicines like paracetamol are actually pretty fascinating. They act directly on the brain to lower the temperature set point. They basically reset the body's thermostat so it can gradually cool down. And sponging the body with water? Well, just make sure to skip the head, but the water on the skin literally absorbs the heat, bringing that baseline temperature down in about 10 minutes. Let's expand on that with this essential home care checklist. First up, rely on actual data. Use a digital thermometer every 4 to 6 hours to keep an eye on things. Next, dress them lightly. I know, the instinct when a kid is sick is to bundle them up in cozy, heavy blankets, but light clothing actually lets that trapped body heat escape. You also want to offer small, frequent sips of fluids, water, breast milk, or oral rehydration fluids. This is absolutely crucial because a fever increases fluid loss through sweating, so giving fluids replaces that loss and keeps their internal cooling mechanisms working. And finally, let them rest. It's totally okay and honestly expected if they're a lot less active than usual. Moving on to section 3, common mistakes to avoid. Because when we're scared, panic often leads to some well-intentioned errors. Let's look at what doctors actually recommend versus what parents mistakenly do in the heat of the moment. Doctors say lukewarm water, paracetamol, and light clothing. But panicked parents, they often reach for cold water or ice baths, aspirin, and those heavy blankets. I want to be incredibly explicit here. Absolutely do not use aspirin in children. Always stick to doctor-recommended medicines like paracetamol or ibuprofen. And those heavy blankets we just talked about, they basically turn your kid's bed into a little oven, trapping all that heat right inside. Now, what's really interesting about this slide is how incredibly counterintuitive it is. You might logically think, hey, my child is burning up, let's cool them down super fast with cold water or ice. Do not do it. Why? Because cold water causes the child to start shivering, and shivering is a muscle movement that actually generates more heat. It completely backfires and raises their body temperature even further. You've got to use normal, lukewarm water to gradually absorb the heat without triggering that shivering defense mechanism. And here are a few more critical pitfalls to watch out for. First, don't wait for the medicine to kick in before giving basic care. Start the simple stuff early, like offering those fluids and stripping off heavy clothes. Also, make sure you aren't using incorrect dosing. Always follow the proper dosage based on your doctor's advice. But here's a huge one. Do not wake a comfortably sleeping child just to medicate them. Seriously, I know you want to fix the number on the thermometer, but sleep is absolutely vital for their recovery. If they're sleeping peacefully, just let their immune system do its healing work. Okay, section 4, when to seek help. Let's remove the guesswork completely. I want to clearly and firmly detail these urgent signs because this is the exact moment you bypass home care and call a doctor immediately. First off, any fever in an infant below 3 months old, especially if they have fast breathing or their chest is drawing in, requires immediate medical attention, period. Other urgent red flags include seizures, shaking, or eyes rolling back. If your child is extremely drowsy, unusually hard to wake up, or just not interacting with you, that's a major warning sign. Plus, if they aren't drinking, they're repeatedly vomiting, or the fever stays high and just won't budge despite your basic care, these are the clear indicators that it's time to seek professional help right away. But what about the vast majority of fevers that don't trigger those severe red flags? That brings us to section 5, the doctor's golden rule. So the crucial point is perfectly captured in this really comforting quote from Dr. Yadov. He says, "What matters more than the number on the thermometer is how the child is behaving." Just let that sink in for a second. As a parent, treating the child is infinitely more important than treating the thermometer. A high number on a digital screen does not automatically equal danger. We have to step back from the device and actually look at the little patient right in front of us. So what exactly are you looking for? Well, are they actively playing? Even if they're a little less energetic than normal, that's okay. Are they willingly drinking fluids? Are they alert and responding well to you? Remember that scary 102-degree fever we talked about at the very beginning? Even with a temperature that high, if they're showing these positive behaviors, it's a massive reassuring sign. It means they're handling the infection well and that your home care is absolutely doing its job. Which brings us to our final empowering thought. By deeply understanding that fever is just a natural defense, knowing the exact immediate steps to take, avoiding those really counterintuitive pitfalls, and prioritizing your child's behavior over a digital readout, you've completely shifted from panic to preparedness. You've got this for sure. But, it kind of makes you wonder, if a high fever isn't the dangerous enemy we always thought it was, what other common childhood symptoms might we be completely misinterpreting? Keep questioning, and thanks so much for exploring this explanator with us today.